Why is it so hard for us to move away from fee for service in this country?
Yeah, I think it's because of the way the system has been structured in terms of payment is that we pay you when something goes wrong. It's like your car goes wrong, you go in and they fix X, Y, and Z, and they get paid for each and every service that they do. So there's no incentive for providers to keep patients healthy. There's no reward for doing a good job. So if you actually improve patients' outcomes or you do a better job with surgery, you're going to get paid just as much as the next guy. And so I think that those the financial incentives have been misaligned. And that's why, perhaps we're not getting the results that we'd like to see. Despite all of the spending that our country spends in healthcare, and the debt that we're accumulating because of that, we have a relatively unhealthy population. And we also see a lot of differences and disparities in terms of health outcomes. I think that's become more of a bigger topic in because of COVID. And so the idea, I think, of value-based care is trying to align financial incentives to hold providers accountable for lowering cost and improving quality. So if you are able to show better outcomes, you get paid more. And if there's savings to the system, you get to share in that. I think that's probably where we need to go as a healthcare system. It's not going to work to ration care. It's not going to work to just throw more money at healthcare and put more people on government programs. The government has not solved these issues. In fact, the government arguably has made it worse, and the programs that the government's been in charge of, Medicaid and Medicare, have huge financial problems. Medicare is about to go insolvent in a few years, and states are struggling to pay for their Medicaid programs. And so I think the strategy really has to be something around going to market-based principles, and value-based care delivers that, by having competition based on quality and outcomes. I think that's what's going to move the needle forward in terms of lowering healthcare costs, or at least trying to limit the growth rate.